And we're joined by Dr. Ben Wiese at Kelowna Skin Cancer Screening. This has become a full-time job for you?
Me and my wife, we are trained family physicians, originally from South Africa, and what we thought initially we're just going to do part-time. After being flooded with referrals from our colleagues, just because there's such a big need to be screened, to be tested, to be diagnosed for skin cancer and melanoma, this is what we do full time. We just do skin cancer, no cosmetic work. We just focus on skin cancer.
Okay, so this is Skin Cancer Awareness Month. If there is one thought that people take away from that, what should they do to act on this topic?
I think it's really important to know your skin. I think you need to, I think most of us, we know our skin because it's our skin, but we don't take particular notice of anything that's new, anything that's different on our skin. I always say anything that's on your skin, know about it. If it's new, if it's changing, make sure that you ask somebody about it. And specifically, I think this is where your family doctor is a great resource. If your family doctor is concerned about it, they'll refer you to us.
Okay, when you say get to know your skin, you're talking in particular about those little things that appear that we would call a mole. Is that a new one, or has it changed? That's the focus?
Right, exactly. And I think that's sometimes the difficulty, in a sense that what you think is just a mole or could actually be a barnacle, what some patients refer to, is actually indeed a skin cancer. And this is where a lot of patients say, oh, it's just an age spot. And luckily, in most cases, it is just an age spot, but you also don't want to confuse that. And I think this is, again, where your family doctor can help you a lot with making
you have a piece of equipment you were showing us that allows you to really map it out.
Right, so we've got our photo finder mole mapper. Now, first of all, that's not for everybody. This is for high-risk patients, specifically for skin cancer or melanoma. And what we do is we take pictures of your whole body, and then for melanoma patients, every 6 months we do the photos. For high-risk patients, we do that every 12 months. And then you compare these moles and photographs. And if we see, again, if anything is new, if anything is changing, we will use then artificial intelligence to help us to make a diagnosis. Because I always say, if you can make the diagnosis when the skin cancer is still in its infancy stage, I basically surgically remove it and I've cured you, compared to that skin cancer growing and spreading. Because melanoma, yes, it does metastasize, liver, brain, and of course you want to do whatever you can to do what you can before you get to that point.
We hear a lot about a lot of different cancers. Breast cancer we hear so much about. You don't hear so much about skin cancer. It's as though people don't seem to take it seriously, but you've got some numbers that might change their mind.
Right, yeah, I think it's really crazy to think that, about 8,000 people in Canada is diagnosed with melanoma. It's the third most common type of cancer that you get.
8,000 would be diagnosed in a year?
In a year, right. Our office is unique in the sense because we just see skin cancer, but I want to go as far as to say we almost see one melanoma a day. This is quite crazy. Now, luckily, they're very early diagnoses, so this is where you cut it out and you're cured. So this is not where you need chemotherapy or radiation.
Right. So that's the thing with skin cancer. It is the most common cancer, I understand?
Indeed.
And it can be minor, I suppose, if dealt with right away. Right.
And I think in that sense, it's exactly the same as breast cancer, because breast cancer at some point was also a minor thing that if it was picked up, then if it was picked up with a mammogram, you diagnose it, you cut it out, you're cured. But the later the diagnosis is made, unfortunately, the worse the outcome.
So if someone has never had their skin looked at by someone like yourself, but they don't have any particular concerns, should they just do it proactively?
No, I think everybody doesn't need to see a physician. You can actually do it yourself. I think this is where taking care of your skin, protecting your skin, and then of course, if something is, changing or new, and this is where only you can actually do that.
Thanks for telling us about it.
Well, you're so welcome.
Dr.
Thank you.
Ben Wiese, and thank you for watching Kelowna Now.